exchange in humans. Gases exchange and the transport of respiratory gases. Blood that enter the lung capillaries contain a higher partial pressure of carbon dioxide compared to the alveolus. Carbon dioxide diffuses out from the lung capillaries into the alveolus before it is expelled into the atmosphere through the nose and the mouth. The partial pressure of oxygen in the alveolus is higher than in the lung capillaries. Oxygen diffuses into the lung capillaries. Oxygen combines with hemoglobin in erythrocytes to form oxyhemoglobin. Blood that leaves the lung through the pulmonary vein has a higher partial pressure of oxygen and a low partial pressure of carbon dioxide. Blood that enters the lung through the pulmonary artery has a low partial pressure of oxygen and high partial pressure of carbon dioxide. Cellular respiration releases carbon dioxide. The partial pressure of carbon dioxide in cells is higher than tissue capillaries. When blood reaches the tissue through the capillaries, the partial pressure of oxygen in the blood is higher than that of body cells because cellular respiration uses oxygen. Carbon dioxide diffuses out from the body cells into the tissue capillaries and is transported back to the lungs. Oxyhemoglobin breakdowns and oxygen diffuses from the tissue capillaries to the body.
So now we are going to learn about the transportation of carbon dioxide in the blood circulatory system. There are 3 ways to transport the carbon dioxide. Firstly, the blood plasma. Second, the carbaminohemoglobin, and the third one is bicarbonate ion. Firstly, the blood plasma. 7% of the carbon dioxide will simply dissolve in the blood plasma. Secondly, the carbaminohemoglobin. 23% of carbon dioxide will combine with hemoglobin to form carbaminohemoglobin. And the last one is bicarbonate ion. 70% of carbon dioxide is carried in the form of bicarbonate ion. There are 2 phases of carbon dioxide transportation. The first one is the transportation of carbon dioxide from body cells to tissue capillaries, while the second one is the transportation of carbon dioxide from lung capillaries to the alveolus. Firstly, we are going to learn about the transportation of carbon dioxide from the body cells to tissue capillaries. To form bicarbonate ion, it needs carbonyl anhydrase enzyme because carbonyl anhydrase enzyme are sensitive towards temperature and pH. The carbonyl anhydrase enzyme will catalyze the reaction between carbon dioxide and water to form carbonic acid, and then the carbonic acid will dissociate into bicarbonate ion and hydrogen ion. The bicarbonate ion then will diffuse into the blood plasma and is carried to the lung. So now we will learn about the transportation of carbon dioxide from the lung capillaries to the alveolus. When the bicarbonate ion in the blood plasma reaches the lung, it will diffuse back into the erythrocyte. Then the carbonic ion will combine with hydrogen ion to form carbonic acid. The carbonic acid will dissociate into carbon dioxide and water. And the carbon dioxide will diffuse through the lung capillaries into the alveolus and is expelled during exhalation.
Now, we will proceed to health issues related to the human respiratory system. In this topic, we will discuss health issues that are related to the human respiratory system, which is chronic obstructive pulmonary disease, COPD. COPD comprises 3 different types of respiratory disease, which is chronic bronchitis, emphysema, and also asthma. When someone is having emphysema, they will face some changes in their respiratory system. The alveolus will lose its elasticity. The size of the alveolus will also increase, but the total surface area of the alveolus will be decreased. It is because the wall of the alveolus is damaged. In addition, the gases exchange will become less efficient. Bronchioles of chronic bronchitis patients will become inflamed, swollen, and also blocked. This action will reduce the flow of air in the human respiratory tract. It also makes it difficult for humans to breathe normally. Inflamed bronchioles will generate a large amount of excessive mucus. It will make them cough continuously. Damaged cilium on respiratory epithelium lining will also cause difficulty in expelling mucus. For an asthma sufferer, their bronchial walls will become swollen and thick. The opening of the bronchial tube will also become smaller, while the air passage of the human respiratory tract will become narrower. This condition leads to breathlessness. It will also be difficult for breathing. Since we are still aware of the COVID-19 pandemic, here are some tips that can help us from spreading the virus to others. Last but not least, stay safe and stay at home.